give a statement.
But it appears that we are getting more information from Washington, D.C., from the American side, than we are our own government.
Now, if you remember, I issued a statement, I think, 4 or 5 days, and said that we are talking with the U.S. government and other global partners on how to deal with the new Ebola, Bundi, which is a variant that has no vaccine. Then on Thursday evening, the president held a high-level meeting with the ambassadors and high commissioners and UN agencies in State House on how we deal with this within the context of global health security. So, I mean, there's nothing shrouded. In fact, you're only busy with Laikipia. We are putting in place 11 quarantine, isolation, and treatment centers across the country. Treatment centers like Kenyatta Hospital is now ready, wards, Moi Teaching and Referral Hospital, the National Police Service Hospital, Alupe Hospital is in preparation. There's another hospital in Bungoma called Kocholie. So, and then we have about 9 counties. No, in fact, by today there were 12 counties of high risk where we are working with the county governments and another risk counties. So in total we have 25 counties where we are working with them on how to put in place measures in the event. As of today, there's no any incident of Ebola in our country, but we are preparing. Diseases like Ebola they don't respect borders. They can cross. So Laikipia Air Base is one of them. Mm-hmm. And let me give you a very good example. Kenya, number 1, is part of the global health security. And we are one of the countries with the best healthcare systems in terms of laboratory, in terms of surveillance in our region. And first, we have set up the Incident Management Center. We have set up the Emergency Response Center.
Where is that? You've set it up where?
Yeah, within Nairobi. I mean, the Public Health Institute, mm-hmm. The National Public Health Institute. That's its main function. The surveillance teams are in place. Our epidemiologists are on high alert. We have trained over 1,000 in these counties on how to prepare in the event Ebola incident is reported in our country. We have the incidents, like so far we have tested 16 people for Ebola. Mm-hmm. Lucky, all of them are negative. 9 in Nairobi, 2 in Uasin Gishu, 1 in another 5 counties, West Pokot, Turkana, and all that one. But these are people who are either in DRC or in Kampala in the last 4 weeks. So our laboratories, 3 of them are in high alert. The National Laboratory in Nairobi, the KEMRI in Kisumu, the KEMRI in Nairobi, and we have a mobile laboratory which is based in Busia.
So we have the capacity to do
No. We have the capacity. But why we have to talk to partners, and it's not the first time. In 2014 to 2016, 170 Kenyan healthcare workers, many doctors, were sent to West Africa. The UN has established a facility in Nairobi Hospital during COVID. During COVID, we turned our Kenya Medical Training Institutes into isolation centers. You know, there's a big difference between you and me. The difference is, it is government and also the Minister of Health and the President to make sure that these Kenyan citizens' public health, safety is protected.
Okay.
And even our visitors, our other global people from other countries who live in Kenya, who work at the UN, who work in multinational institutions, who work in even development partners in the health sector.
All right, but you can understand the concern of Kenyans, because this is not a case where a visitor perhaps has come into the country and has been found to have Ebola. This is a case where Kenya will deliberately bring in people who have Ebola from the DRC, American nationals, to be specific. So the question Kenyans are asking, as I understand it, you tell us what the details are.
Yes.
But as I understand it, Kenyans are asking, why are Americans putting Americans first and saying they will not allow any person infected with Ebola into the country, but Kenya is not putting Kenyans first?
Let me say it this way. In DRC, where the epicenter of the Ebola is happening, I had an opportunity to visit those areas when I was a Minister for Defense. There are over 350 Kenyan KDF soldiers working for the UN, MONUSCO, as we speak today. A whole battalion of signal and the Kenya Defense Forces Quick Response Team. We have a huge population of Kenyans doing business in DRC. Our two major banks, Equity and KCB, are based in DRC. So before we are even concerned with why are we bringing Americans, we should be concerned with a Kenyan or any other person who crosses the border between 12 to 15 hours, has no fever, comes into our country. The incubation period is 3 weeks. After 3 weeks within our country, he develops the fever and all the symptoms. By then, he has had many contacts with our citizens, with his family, and then he's found with Ebola. And there's no way where it is said we are bringing Ebola patients to Laikipia. That facility is a military facility. Kenyans Defense Forces will use that facility. Other Kenyans will use that facility. And by the way, let me say this. I don't know why people are so much about the US. If there's one country that has contributed between 25 to 35% of the health budget since independence, is the US, among many others. And that's why today, the cooperation agreement we have signed is about 206 billion. So we built over the years the healthcare system that we are proud of regionally. Today, our labs are the best, the Cambry. They were not built only by us. We played a role, but we built it with partners and other countries, WHO, the US being one of the biggest funder. So Laikipia is one of the isolation center, and it is very far from any community, even within the barrack. And now that we have a court order, the court has told us, given us 48 hours to submit our submissions. The Attorney General, the Chief Legal Advisor, has already submitted the submission. So it's not about, we are not talking about a normal situation. It's not about something that, I saw what my good friend, Dr. Atela, what his message, he was saying that we should close our border to anybody, is different from what Dr. Tedros of WHO, if you watch either CNN or Al Jazeera, was urging the neighboring countries that let's work together. Let's make sure this.
So is everything that is happening in this country interesting, or something that the government of Kenya or the government of the day should look into it and try and change it? This is a very strange thing happening in this country. Ebola again in Kenya. There are very many troubles that Kenyans are going through. And I believe sicknesses like this one or inviting such a things to happen in the country might have another problem in this country and we should not look at it. Though the other people look at it in a different way, like it's something that's going to help the health systems of this country, maybe improve the health systems of this country, but why and when it is going to happen? Is there something greater than just Ebola that is happening in this country and people don't want to talk about it? And the leaders know, and they've decided to keep quiet. And because they've ate big, or they've ate it on a big spoon, they'd rather keep quiet about that and not talk about it. It's kind of interesting. But it is. This is the whole of the day, and this is the leadership of this country doing all this and that they're doing. So rumors here and there. Why? As people are coming up with different school of thoughts on why, when, what is really happening, and all that. All this is summing up to one thing, that is the leadership of this country is not working as supposed to work, and things are not just working in this country. And that is what the president should be looking into. So why? Why all this? Why now? If you have an answer to any of these questions, why, can you leave it in the comment section and tell us what you feel about this story?